Prajmaline neo-gillarhythmal, is a Class Ia antiarrhythmic agent which has been available since the 1970s. Class Ia drugs increase the time one action potential lasts in the heart. Prajmaline is a semi-synthetic propyl derivative of ijmaline, with a higher bioavailability than its predecessor. It acts to stop arrhythmias of the heart through a frequency-dependent block of cardiac sodium channels. Mechanism. Prajmaline causes a resting block in the heart. A resting block is the depression of a person's Vmax after a resting period. This effect is seen more in the atrium than the ventricle. The effects of some class I antiarrhythmics are only seen in a patient who has a normal heart rate, approximately 1 Hz. This is due to the effect of a phenomenon called reverse use dependence. The higher the heart rate, the less effect Prajmaline will have. Uses. The drug Prajmaline has been used to treat a number of cardiac disorders. These include coronary artery disease, angina, paroxysmal tachycardia and Wolff-Parkinson-White syndrome. Prajmaline has been indicated in the treatment of certain disorders where other antiarrhythmic drugs were not effective. Administration. Prajmaline can be administered orally, parenterally or intravenously. 3 days after the last dose, a limited effect has been observed. Therefore, it has been suggested that treatment of arrhythmias with Prajmaline must be continuous to see acceptable results. Pharmacokinetics. The main metabolites of Prajmaline are 21-carboxyprajmaline and hydroxyprajmaline. 20% of the drug is excreted in the urine unchanged. Daily therapeutic dose is 40 to 80 mg. Distribution half-life is 10 minutes. Plasma protein binding is 60%. Oral bioavailability is 80%. Elimination half-life is 6 hours. Volume of distribution is 4 to 5 L per kilogram. Side effects. There are no significant adverse side effects of Prajmaline when taken alone and with a proper dosage. Patients who are taking other treatments for their symptoms, e.g. beta blockers and nifedipine, have developed minor transient conduction defects when given Prajmaline. Overdose. An overdose of Prajmaline is possible. The range of symptoms seen during a Prajmaline overdose include, no symptoms, nausea, vomiting, bradycardia, tachycardia, hypotension, and death. Other potential uses. Due to Prajmaline's sodium channel blocking properties, it has been shown to protect rat white matter from anoxia, 82 plus or minus 15%. The concentration used causes little suppression of the pre-anoxic response. References.